Have you ever walked out of the dentist with that heavy feeling? The diagnosis hit, the bill hit right after, and nobody properly explained why it happened again? You know what's worse? You brush, you floss, you use mouthwash, and the cavity still shows up. I get that frustration. And today I want to show you something that will completely change the way you take care of your mouth, before bed, with ingredients you probably already have at home. If someone told you that cavities are irreversible outside of a dental office, that person has never seen what happens when you give your tooth exactly what it needs to rebuild itself. Because there is a real, documented biological process called remineralization, and it happens naturally in your body every time the right conditions are created. In this video, I'm going to show you how to create those conditions. A simple, layered nighttime protocol that works while you sleep. No magic promises. Just science. Oh, before we go any further, the full protocol with the exact sequence, ingredients, and step-by-step breakdown is in the first pinned comment right below this video. Open it in a separate tab while you watch, because you'll want to take notes. Imagine you could pick up a microscope and look at a slice of your tooth, a cross-section, like those geology images that show the layers of the earth. On the outside, you see the enamel, a white, hard structure organized into columns of microscopic crystals called hydroxyapatite. Think of a honeycomb, except instead of wax, it's calcium and phosphate packed into a hexagonal shape. Each column is only a few micrometers wide, but together they form the hardest material in the human body. Now go deeper. Just below the enamel is the dentin, more porous, more sensitive, with tiny tubules pointing toward the nerve. This is where sensitivity pain lives. When the environment inside your mouth becomes acidic, and I'll explain exactly what causes that, those hydroxyapatite crystals start to dissolve. Calcium and phosphate ions literally escape the structure. The honeycomb fills up with invisible holes. This is the beginning of demineralization. What most people don't know is that this process is bidirectional. Just as acid pulls minerals out of the tooth, the right environment puts those minerals back, and the crystal rebuilds itself. It's like repairing the cells of a honeycomb with fresh wax, cell by cell. This rebuilding process is called remineralization. And it's most efficient at night. When saliva production drops, the environment stabilizes, and minerals can deposit without interference. That's why what you do before bed is exponentially more important than what you do in the morning. A cavity doesn't just appear out of nowhere on a Tuesday morning. It has stages, and understanding those stages is what separates people who act in time from people who find out too late. Stage 1, the white spot. The enamel has lost minerals in a localized area, but it's still structurally intact. You might see a small opaque, whitish, dull patch. At this point, remineralization can fully reverse the process. No drill needed. Stage 2, the early lesion. The enamel starts to give way. A microscopic cavity is forming. Sensitivity to cold or hot foods may begin. Conservative intervention is still possible, but the window is closing. Stage 3, the point of no return. The acid has broken through the enamel and reached the dentin. When this happens, no home protocol, no natural substance, no DIY technique can reverse the structural damage. Dentin does not regenerate the same way enamel does. From here, you need professional intervention. No exceptions. The problem is that most people can't tell the difference between stage 1 and stage 3 just by looking in the mirror. And while they wait for pain to show up as a warning signal, the process has already moved past the point where prevention was possible. Acting at stage 1 and 2 is the difference maker. And that's exactly what the protocol I'm about to show you was designed to do. You've probably heard that cavities are caused by brushing wrong. That if you brush 3 times a day the right way, everything's taken care of. But I need to tell you something. That's not what the science shows. It's not your brushing technique that determines whether you get a cavity. It's the pH of your mouth throughout the day. You could brush 5 times a day with the best toothbrush on the market, And if your oral environment stays acidic for hours at a time, demineralization will keep happening between every single brushing. Brushing removes plaque, but it doesn't structurally change your pH. Another popular myth: sugar causes cavities. Not exactly. Sugar feeds the bacteria that produce acid, and it's the acid that causes the cavity. That distinction matters because it changes where you need to intervene. It's not just about cutting sugar. It's about reducing the time your teeth are exposed to acid. And finally, many people believe remineralization is a process that only happens with clinical products or fluoride varnish applied by a dentist. That's not true. The human body remineralizes teeth naturally, every single day, as long as the oral environment allows it. What most people were never given is the instruction on how to create that environment. Dentists treat damaged teeth. Very few have the time or the incentive to teach you how to prevent the damage from happening in the first place. That's not a criticism. It's just the reality of how the system works. There are causes everyone knows about, and causes nobody talks about. I'm going to show you both. 1. Chronic oral acidity, the primary cause. Every time you eat or drink anything other than pure water, mouth bacteria produce acid for up to 40 minutes. If you snack throughout the day, coffee with sugar at 9 a.m., a piece of fruit at 11 a.m., a juice at 2 p.m., your mouth never returns to a neutral pH. Demineralization is constant, and remineralization never gets a chance to work. 2. Insufficient saliva at night during sleep. Saliva production drops dramatically. Saliva is your tooth's natural defense system. It neutralizes acid, carries minerals, and contains antimicrobial proteins. If you go to sleep with food residue in your mouth without having created a favorable environment first, those hours of sleep become a prolonged attack with no defense. 3. Mouth breathing. This is one of the invisible villains. Chronic mouth breathers have a persistently dry mouth, and dry mouth means less saliva, more acidity, more risk. This is especially common in areas with high rates of rhinitis and seasonal allergies. 4. Acidic drinks disguised as healthy lemon water in the morning. Fresh orange juice, kombucha, iced tea. All of these have a low pH, between 2.5 and 4.0. Consumed frequently, especially without neutralization afterward, they're just as corrosive to enamel as soda. This is the second invisible villain, the product that looks healthy and is silently destroying your dental structure. 5. Systemic mineral deficiency. Calcium, phosphorus, magnesium, and vitamin D are the building blocks of enamel. A diet poor in these nutrients creates an environment where the body can't remineralize efficiently, even if every other condition is correct. This is the core of what I want to show you. A 4-layer system, applied before bed, that creates the ideal environment for remineralization to happen while you sleep. Layer 1. Foundation. pH neutralization. What it is: eliminating residual acidity before sleep. Why it works: remineralization only happens when the mouth's pH is above 5.5. Below that, the process reverses, and you lose minerals instead of gaining them. Creating this neutral base is the prerequisite for everything else. How to implement: after your last brushing, do a light rinse with filtered water and a pinch of pure baking soda, food grade, not baking powder. This neutralizes residual acid without damaging the enamel, as long as it's used in minimal amounts and not as a daily abrasive. Once a day, at night, swishing for 30 seconds, is enough. Timeline. pH effects begin immediately. Within 1 to 2 weeks, you'll notice a reduction in morning sensitivity. Layer 2. Accelerator. Active remineralization. What it is: delivering the minerals the tooth needs to rebuild itself. Why it works: enamel is 96% mineral. When you create a favorable pH environment and supply calcium and phosphate ions directly to the tooth surface, remineralization becomes an active process, not just a passive one. The specific application sequence here makes all the difference. Neutral environment first, mineral delivery second. How to implement. There's a category of remineralizing products that contain amorphous calcium phosphate or nanohydroxyapatite, the same substance as enamel. Applied after neutralization, they literally deliver building material directly where the crystal needs to be repaired. I won't name brands here, but the 2 ingredients you need to look for on the label are exactly those. The full list of resources I use is in the first pinned comment. Timeline. First signs of sensitivity improvement, 3 to 4 weeks. Visible remineralization on white spots, 2 to 3 months. Layer 3. Protector. Overnight barrier. What it is: creating a protective layer over the enamel during sleep. Why it works. During sleep, you don't produce enough saliva to neutralize attacks. A thin physical barrier over the enamel acts as a shield, blocking bacterial contact with the tooth surface during the most vulnerable period of your 24 hours. How to implement. Specific plant-based oils and the timing of application is critical. Create this layer naturally, without problematic residue. The secret is in which oil to use and at which point in the sequence to apply it. The exact timing between protocol steps is detailed in the first pinned comment. Timeline. Immediate protection every night. Reduction in new sensitivity episodes within 4 to 6 weeks. Layer 4. Optimizer. Systemic nutrition. What it is: making sure the body has the raw materials to remineralize. Why it works. The nighttime protocol works at the local level, but if the body is deficient in the minerals the tooth needs, the process has a ceiling. Vitamin D3 plus K2 direct calcium to bones and teeth. Magnesium activates vitamin D. Phosphorus from food sources completes the cycle. How to implement. Review your diet with a focus on quality dairy or calcium-rich plant sources, proteins that provide phosphorus, and adequate sun exposure or D3 supplementation. It's not a special diet, it's making sure the basic nutrients are present. Timeline. Systemic effect noticeable within 2 to 3 months of consistency. 1. Stop using baking soda as a direct abrasive. Mixed onto a toothbrush, it has greater abrasive power than enamel itself. Over time, it wears down the very layer you're trying to protect. Using it diluted as a mouth rinse is different, but never on the brush. 2. Stop using whitening products on a weekly basis. Hydrogen peroxide at high concentrations, used repeatedly, temporarily demineralizes enamel and increases surface porosity. Whitening has its place, but never during an active remineralization protocol. 3. Absolutely stop drinking lemon water on an empty stomach. The morning detox ritual is one of the biggest enamel saboteurs out there. You're bathing your teeth in pH 2.0 at the exact moment they're most vulnerable, saliva production still low from sleep. If you want the benefits of lemon, take it in capsule form or with a meal. 4. Stop using clove oil as a daily anti-inflammatory. Eugenol has real properties, but with frequent direct application, it irritates the dental pulp and can compromise tooth vitality long-term. Use it with guidance, not as a daily routine. 5. Never brush immediately after acidic meals. Wait at least 30 to 40 minutes. After acid exposure, enamel is slightly softened. Brushing at that moment removes material that would naturally be remineralized by saliva. It contradicts everything that seems obvious, but it's exactly what the science shows. 6. Stop using alcohol-based mouthwash at night. Alcohol dries out the oral mucosa, reduces saliva production in the following hours, and increases acidity, the exact opposite of the environment you want to create before bed. 7. Stop snacking after 8 p.m. without brushing afterward. An innocent cracker at 10 p.m. creates 40 minutes of acidity that flows straight into your sleep hours. If you need to eat late, always finish with water and the neutralization protocol.